define, or what do you think, what is the we are going to discuss today the anterior abdominal wall. So that means हमें इसका extent पता होना चाहिए कि from where to where this abdominal wall extends. So anybody from you wants to answer this question? So anterior abdominal wall, if somebody asks you to limit the anterior abdominal wall, what are its superior boundaries, what is located inferiorly, from where to where it extends laterally, so what are the boundaries? Raise your hands. Superiorly, so that means she is saying superiorly there is diaphragm, and inferiorly she is saying inguinal ligament. Inguinal ligament. So if we say abdominal cavity, if we talk about abdominal cavity proper, that extends from the diaphragm, thoracoabdominal diaphragm, to the pelvic diaphragm. But if we talk about the anterior abdominal wall only, the anterior abdominal thing, that extends from the costal margin, because we have to define certain bony structures. According to that, we limit the extent. Then inferiorly, as there is no bony structure, so we can think of the inguinal ligament, which extends from the anterior superior iliac spine to the pubic tubercle. For the functional or for studying purpose, we divide the abdomen, or I would say there are two regions. One is abdomen proper, and the next is the pelvis. So we have to define the limits from where to where is the abdomen, where is the pelvis. So if we define only anterior abdominal wall, so in the center there is xiphoid process, then there are costal margins, then laterally it extends to the mid-axillary line, and below you can see there are the inguinal ligaments, and in the center there is the inguinal ligaments are extending to the pubic tubercle, and then there is pubic symphysis. So this extent is only for the anterior abdominal wall. I am not saying abdominal cavity. Abdominal cavity is extending from thoracoabdominal diaphragm to the pelvic diaphragm. So then this to the pelvic inlet, the bony framework which is forming the abdomen, you can think of the bony framework. This is what? This is the xiphoid process. Then this is the lower margin of the 7th, 8th and 8th. Through the 7th rib, the 8th, 9th and 10th ribs are attached, and 11th, 12th ribs are floating. Then posteriorly, what is located? The 5 lumbar vertebra, they are located. Then on the sides, there are the iliac crest, the ilium bone. So this is the bony framework which is there in the abdomen. As there is no structure inferiorly, so there is inguinal ligament extending from anterior superior iliac spine to the pubic tubercle, not to the pubic symphysis. So anterior abdominal wall, if we can think it of as an hexagonal area which is limited superiorly by the costal margins and the xiphoid process, laterally by the mid-axillary line, inferiorly by the iliac crest, the pubic crest, pubic symphysis. But iliac crest and the pubic tubercles, they are not connected, so there is inguinal ligament. So these are the margins or the extent of the pelvic, the anterior abdominal wall. Then if we say how much region is the abdomen, and then from where the pelvis proper starts, so pelvis starts at this pelvic inlet. Above this pelvic inlet, there is abdominal cavity till the diaphragm. अब ये pelvic inlet क्या है? पहले मुझे ये बताओ, अगर हम ये circle को pelvic inlet कह रहे हैं, then the part of the ilium is in abdomen or pelvis? ये iliac जो fossa है, that is located in abdomen or pelvis? Abdomen. That thing you have to remember. So that means this pelvic inlet divides the abdomen proper and the pelvis. अब ये pelvic inlet के लिए हमें कुछ मतलब the bony landmarks we have to remember for the pelvic inlet. So can we think, can you just make out the what are the bony landmarks for the pelvic inlet? If we start at the sacrum posteriorly, this is known as the promontory of the first sacral vertebra. So it is located posteriorly. These are known as the ala of the sacrum. Then sacrum is articulating with the ilium at the sacroiliac joint. Now this is the medial border of the ilium, which is ये जो red colored line है, this is known as the arcuate line. It is continuous till the iliopubic eminence. Then there is pecten pubis, and then there is pubic tubercle, pubic crest, and then there is pubic symphysis. So if we go from anterior to posterior, in the center what is there? Pubic symphysis, then there is pubic crest, pubic tubercle, pecten pubis. This pubis articulates with the ilium. So there is iliopubic eminence. Then beyond the iliopubic eminence, there is medial border of the ilium. We are calling it as the arcuate line. Then this is the margin of the ala of the sacrum, and this is the promontory. Once again, जो तुम लोगों ने अभी hip bone पढ़ा था, again you will be reading the hip bone along with the whole pelvis, because two hip bones and the sacrum combinedly they are forming the pelvis. So that means for the abdomen per se you will be reading it again, and then these landmarks you will be able to see on the bone also. So this is the pelvic inlet which is dividing the abdomen. Above this pelvic inlet there is abdomen, and below the pelvic inlet there is pelvic cavity proper. So the region which is going to begin from today is the abdomen proper. So that means we will be talking about the structures which are located between the costal margin and this pelvic inlet. So how will we study the anterior abdominal wall? We have to divide it into certain regions, quadrants. So there are 4 quadrants. These 4 quadrants are divided how? One line is drawn from the xiphoid process to the pubic symphysis, and this transverse line is passing through the umbilicus. And then we divide this into 4 quadrants. Very easy to describe. ये बहुत अभी लगता है कि इसे क्यों ये कर रहे हैं? When a patient comes, he says that जितना भी abdomen है, he always says कि पेट में दर्द हो रहा है. वो पूरा ही वो stomach है, पर कौन सा quadrant affected है? You have to write in the history that अभी quadrant के बाद इससे भी और ज़्यादा specific है. There are clinically 9 regions. We divide the anterior abdominal wall into these 9 regions. So that means the viscera which are located in a particular region, which viscera is affected, we can tell there is pain in the right hypochondrium, there is pain in the left hypochondrium. So we have to describe those things in terms of these regions. Now अब 9 quadrants बनाने हैं, तो इसके लिए 2 vertical lines दिख रही हैं और 2 horizontal lines हैं. So these vertical lines are roughly they are the mid clavicular line, and inferiorly they are passing through the mid inguinal point. What is mid inguinal point? Between the pubic symphysis, just a midpoint between the anterior superior iliac spine and the pubic symphysis, there is a mid inguinal point, and roughly they correspond to the mid clavicular line. So we have got the vertical lines. Now these 2 horizontal lines, they are at a certain specific points, and different planes are used to describe them. The upper plane is known as the transpyloric plane, as it passes through the pylorus part of the stomach, and it is located at the lower border of L1 vertebra. Then you can see there is transtubercular plane. This transtubercular plane is connecting the two iliac tubercles. Where are the iliac tubercles located? 5 centimeter behind the anterior superior iliac spine on the outer margin of the hip bone. You have seen two tubercles. They are the iliac tubercles. So this transtubercular plane located at L5 level, it is passing through those tubercles and then it is connecting with that. So this way there are 9 quadrants. Now how the quadrants are? The central quadrant in which the umbilicus is located, that is the umbilical quadrant. Above the umbilical quadrant in the center there is epigastrium. Below umbilical there is hypogastrium. Then this is hypochondrium. These are the hypochondria, the right hypochondrium and the left hypochondrium according to the ribs, because they are located below the ribs. So hypochondria. Then these two are the lumbar regions and these two are the iliac regions. So that means you have to remember what? The two planes. So अभी जब आप dissection hall में जाएंगे, you have to try to make all these quadrants. You have to make these two lines, try to palpate the iliac tubercles, connect the two iliac tubercles, then just feel where is the L1 vertebra. So just this is the transpyloric plane at the lower border of the L1 vertebra. And roughly it is located midway between the xiphoid process and the umbilicus. So this is also कि हम अगर पीछे से नहीं देख पा रहे, so roughly it is located midway between xiphoid process and the umbilicus. So this is the transpyloric plane. So then you can name these regions. So according to the viscera, can somebody tell me stomach is located in which regions? क्योंकि अब तुम्हारी हर क्लास में जब भी तुम कोई विसरा पढ़ोगे, first thing will be you will be defining it is located in which region. So stomach is located in which region? Which hypochondrium? Towards left hypochondrium, somewhere in the umbilical region also. So it will be like so left hypochondrium, the epigastrium part also it will be occupying. That means you have to define the extent from where to where or which regions are occupied by a certain viscera. Like spleen particularly is located in the left hypochondrium and it enlarges towards the right iliac fossa. So this also splenic enlargement दिख रहा है, वो अपने quadrant से अगर इस तरफ इतना बड़ा spleen मिल रहा है, so this also one can also demarcate like this. So these are the regions: the epigastrium, the umbilical region, the left hypochondrium, the right hypochondrium, umbilical, pubic, and these are the regions. So stomach, you can see the liver also. Liver is extending from this right hypochondrium. It is going, its left lobe is going towards left. So this way, these are the regions. Now, what are the layers in the anterior abdominal wall? So if we talk about the layers will be same. जैसा हम बाकी की body में देखते हैं, वैसा ही anterior abdominal wall में. So the outermost layer will be skin. Superficial fascia. Is there any deep fascia in the abdomen? No, there is no defined deep fascia in the abdomen. Why? Why there is no deep fascia in the abdomen? Because the viscera have to expand and then relax also. So that means a space is required for their expansion. So that is why there is no deep fascia. So there is skin, there is superficial fascia. Here there are two layers. Then below the superficial fascia, what will be there? Deep fascia नहीं है, तो अब क्या आ जाएगा? Muscles. So how many muscles were there in the thorax? 3. Similarly, there are 3 muscles in the anterior abdominal wall: the external oblique, internal oblique, and the transversus abdominis. Then again, the muscles will be lined from their inner side by a fascia, that is the fascia transversalis. So after the fascia transversalis, there will be extraparietal extraperitoneal tissue, and then inside the extraperitoneal tissue there will be peritoneum. That is why we are calling that tissue as extraperitoneal tissue. And peritoneum, similar to the pleura, it has got the two layers, the parietal and the visceral layers. तो जैसा pleural cavity था वैसे ही peritoneal cavity है, ठीक है? Because at the time of development there was a single cavity and that was known as the body cavity, and that was divided by diaphragm. तो जैसा thoracic cavity में था और ही किसमें है? Peritoneal cavity में. So these are the layers. So can you enumerate the layers? What are the layers in the anterior abdominal wall? The skin, superficial fascia, muscles, three muscles, external oblique, internal oblique, transversus abdominis, fascia transversalis. After fascia transversalis there is extraperitoneal tissue, then peritoneum, and then there are viscera. Two layers in the peritoneum, then parietal and the visceral layer, and then the superficial fascia has also got two layers. The superficial fatty layer, that is the Camper's fascia, and the deep membranous layer, that is the Scarpa's fascia. So the fat, we know that fat is deposited in the superficial fascia. Here the layer in which fat is deposited is the Camper's fascia, and below the Camper's fascia there is membranous layer, that is the Scarpa's fascia. So it is divided into, so again you can have a look. This is the skin, the superficial fatty layer or the Camper's fascia, the membranous layer or the Scarpa's fascia. The deep fascia are between the muscles. As such, there is no defined deep fascia. Then between these are the three muscles: the external oblique, internal oblique, transversus abdominis, extraperitoneal tissue, the fascia transversalis, extraperitoneal tissue, and then there will be peritoneum. So these are the layers. Now the skin of the anterior abdominal wall, it will be supplied by certain cutaneous nerves. So which cutaneous nerves can you think of? They will be supplying the abdominal region. Which thoracic? T10, you have heard of T10. So T10 is at which level? It is at the level of umbilicus. ऊपर से चलते हैं, तुमने अपर लिम्ब पढ़ लिया है. अपर लिम्ब में what was the root value of the spinal nerve supplying the upper limb? C5 to T1. Then thoracic cavity is supplied by the T1 to the upper 5, there are 12 thoracic nerves, so upper 6 thoracic nerves, they supply the thoracic cavity, and the lower thoracic nerves from T7 to T12 along with L1, they supply the abdominal cavity. So lower thoracic nerves from T7 to T12 along with the lumbar, they are supplying the abdominal cavity. Can somebody tell the other lumbars are supplying which region? You have read that region. They are supplying the lower limb, and basically because lower limb is an expansion beyond the abdomen, so they are supplying the lower limb. Then sacral nerves are there in the perineal region. So remember the root value of the femoral nerve, it is L2, L3 and L4. So these are the spinal nerves, the lower 6 thoracic nerves and the L1 root, they are supplying the skin of the anterior abdominal wall. So what is there in the anterior abdominal wall? It is skin, soft tissue, muscle and the connective tissue. Now the superficial fascia has got two layers, the superficial fatty layers, the Camper's fascia and the deep membranous layer, that is the Scarpa's fascia. Now we have to define the extent of the superficial fascia. So it is continuous with the superficial fat over the rest of the body. One thing which you have to remember is it is modified into a thin, smooth muscle, that is the dartos muscle in the scrotum. So in the scrotum, it is modified inferiorly, and then superiorly it is continuous with the hypodermal fat which is everywhere else. Then next layer is the Scarpa's fascia or the deep membranous layer. सुपरफिशियल फेशिया का एक्सटेंट ऐसे बहुत नहीं पूछते हैं, पर इट हैज गॉट एक्चुअली ये अलग अलग जगह इन द मिड लाइन. दिस पर्पल कलर्ड लेयर इज द Scarpa's fascia. So you can see in the midline it continues as a fundiform ligament in males in the penis. Then over the pubic crest it will be continuous as the dartos muscle, and beyond the pubic crest, that means laterally it will be fusing with the fascia lata of thigh. So there was a deep fascia in the lower limb, that was fascia lata. It is fusing with the superficial fascia. एक close line बना रहा है, but beyond the pubic crest. So that means lateral to the pubic crest, it is attaching to the fascia lata. At the pubic crest, it will be continuous as the dartos muscle, plus it will be fusing with the Colles fascia of the perineum. You might be thinking, तुम्हें याद रखनी है तीन चीजें, fundiform ligament, Colles fascia and dartos muscle, and the fascia lata of thigh. ये इसका significance जो है, that you will be knowing in the, when you will be reading perineum. Sometimes there might occur extravasation of the urine when the bladder becomes overfilled. Then that urine will not extravasate into the lower limb. Why? Because there the two layers are fused. The Scarpa's is fused with the fascia lata. It can extravasate in the perineum because here the Scarpa's is fusing with the Colles fascia of the perineum. So that you will be knowing when reading the Colles fascia. अभी सिर्फ तीन ये याद रख लो. So there is a fatty layer, there is a membranous layer. So they are continuing with the this fundiform ligament of the penis. It is becoming continuous as the dartos muscle. Then laterally it is fusing with the fascia lata of the thigh. This is for your understanding, and I think nobody is going to ask it. So in male it extends as fundiform ligament. So this like that. So inferiorly it fuses with the iliac crest, it fuses with the fascia lata, it extends onto the scrotum. It becomes continuous with the membranous layer of the superficial fascia of the perineum, that is the Colles fascia. Now next, this is the transverse section of the abdomen. You can identify the layers of the abdominal wall in this transverse section. So which is the outermost layer? Which is the outermost layer in the anterior abdominal wall? The skin. Below the skin there is superficial fascia में fat दिख रहा है, तो which layer of the Camper's fascia? And this below the camper or inside the Camper's fascia there is Scarpa's fascia. Then after Scarpa's, these are the three muscles: external oblique, internal oblique, and the transversus abdominis. Do you name these muscles? Can you name these muscles which are present in the midline? These are the rectus abdominis. When there are two, so they are the recti abdominis. Then inside the abdominis, there is this fascia is fascia transversalis. Because inside the transversus abdominis, there is fascia transversalis, and inside the fascia transversalis, there is extraperitoneal tissue, and these you can see, these are the peritoneal layers. These are the reflections of the peritoneum passing on to different viscera. So this is how the different layers are there in the abdomen. Now we have to read the origin and insertion of these three muscles. Along with the oblique and the transversus abdominis, there is rectus abdominis. There is one small muscle, pyramidalis muscle. Sometimes it is present, sometimes it might be absent. So that muscle is the pyramidalis muscle. Now, do you remember the direction of fibers of the external intercostal muscle? How the fibers are arranged? Forward, downward and medially. Similarly, the fibers of external oblique are also arranged जैसे हम pocket में hands डालते हैं, forwards, downwards and medially. Then internal oblique, it is at the right angle. So, so it will be forward, upwards and medially, because all will be inserted in the rectus abdominis, the aponeurosis around the rectus abdominis. So it will be like that. Then transversus abdominis has got transverse fibers. So more or less it has got transverse fibers. Then there are two vertical muscles, the rectus abdominis and the pyramidalis. So now origin, and these are the fibers of the external oblique muscles. They are arranged forward, downwards and medially. So you can see the fibers. Anybody, the insertion of the external oblique muscle, iliac, where in the iliac crest? Outer lip, whole of the outer lip is, it is attached to whole of the medial 2/3, anterior half of ventral segment of the, that means anterior 2/3 segment of the iliac crest. So it is inserted there. Then its origin is from the, its origin, you have read ribs also. Costal margin, rib, it is from the ribs. It is from the outer surface and lower border of the lower 8 ribs. So this is, so 8 fleshy slips from lower 8 ribs from the outer surface and the lower border of the ribs. So it will run downward, forward and medially, and most fibers will end in an external oblique aponeurosis. Now here I want to tell you is that all these three muscles, ultimately they have to come in the midline. They will be forming an aponeurosis. What is aponeurosis? Flattened tendon. So that flattened aponeurosis or flattened tendon will be forming a sheath around the rectus abdominis muscle, and that sheath is known as rectus sheath. So rectus sheath is formed by the external oblique, internal oblique and the transversus abdominis. So that means in the they have to come in the midline to form that sheath. So insertion, most of the fibers will be ending in aponeurosis. Lower fibers are inserted into the ventral half of anterior 2/3 of outer lip of iliac crest. So they are arranged like on the outer lip there is external oblique, on the intermediate lip there is internal oblique, and on the inner lip there is transversus abdominis. But one to remember, external oblique is inserted onto the hip bone, internal and transversus abdominis are taking origin from the iliac crest. So that is why they are going in a different direction. So there is one more thing, that is the inguinal ligament, and thickened lower border of external oblique aponeurosis forms the inguinal ligament. So inguinal ligament is what? It is actually the thickened lower border of the external oblique aponeurosis. So it extends from, it is extending from anterior superior iliac spine to pubic tubercle. So when you will be doing the dissection, you will be seeing how beautifully the white fibers, they get thickened along the line extending from the anterior superior iliac spine to the pubic tubercle. ऐसा flat sheath चल रहा होता है, नीचे you will be seeing कि there is thickening, so that will be. Now here you can see the direction of the fibers of the three muscles. So this is the external oblique muscle, this is external oblique aponeurosis, this is the spermatic cord, this is the inguinal ligament. Now this is the internal oblique muscle and this is the transversus abdominis. So these are the three muscles. ये कौन सा muscles है? Rectus abdominis. There are three intersection in this muscle. We will be talking about that. So pyramidalis will be located somewhere here. Conjoint tendon में आते हैं. Then this is the internal oblique muscle. Its fibers are running upwards, forwards, and medially. Its fibers are going. They are at the right angle to the external oblique. So the external oblique was going downwards. Now its fibers are going upwards. So where it is taking origin from where? Yes, one origin is from the intermediate lip of the ventral segment of the iliac crest. But one thing you have to remember, सबसे लंबा हम इसका origin draw करते हैं उसके ऊपर iliac crest. It occupies whole of that 2/3 part. सिर्फ एक यही muscle है which is attached to whole of that 2/3 part. So it is and whole of the anterior 2/3 of the iliac crest. Then it also takes origin from the lateral 2/3 of inguinal ligament. So some of its fibers are also coming from the lateral 2/3 of inguinal ligament. Some are coming from thoracolumbar fascia. They are inserted onto the lower 3 or 4 ribs, and rest of them will end in the aponeurosis. So it is taking origin from below, insertion is above. How many ribs are involved above? Lower 3 or 4 ribs. Can you number which are the lower 3 or 4 ribs? 9, 10, 11 and 12. So these are the lower 3 or 4 ribs. Then nerve supply is by the T7 to T12 and L1. The same spinal nerves we will be seeing. जैसे उसमें neurovascular bundle था, ऐसे ही the neurovascular bundle of the abdomen is located between the internal oblique and the transversus abdominis muscle, and it is giving the motor supply and as well as the cutaneous branches. Now the next muscle is the transversus abdominis. बहुत बड़ा इसका origin है. It is taking origin from lateral 1/3 of inguinal ligament, from thoracolumbar fascia, from lower 6 costal cartilages. It is taking origin from the lower 6 costal cartilages also, from the anterior 2/3 of the iliac crest. That means transverse fibers from everywhere, and then they will be end in a broad aponeurosis around the rectus sheath, around the rectus abdominis muscle, forming the rectus sheath. So then it is also supplied by T7 to T12 and the L1 thoracic spinal nerves. समझ आ रहा है यहाँ तक? It is taking origin from lateral, from the inguinal ligament is what? What is inguinal ligament? It is the thickened lower border of external oblique aponeurosis. But it is providing origin to two muscles, to the internal oblique and to the transversus abdominis. Internal oblique was taking origin from its lateral 2/3 part, and this is taking origin from the lateral 1/3 part. Then one of the origin of all the three muscles, the insertion is on one thing which is common is the iliac crest. So there was an outer lip, there is intermediate lip, there is inner lip of the iliac crest. So from the inner lip of the iliac crest, from the anterior 2/3 part, this transversus abdominis muscle, it is taking origin, plus it is taking origin from the lower 6 costal cartilages. Then all the fibers, they will be ending into a broad aponeurosis, which will be forming the rectus sheath. Then the nerve supply is T7 to T12 and the L1. Then the next muscle which is there is the rectus एब्डोमिनिस। कैसा मसल है ये? बिल्कुल स्ट्रेट दिख रहा है, वर्टिकल है, सो दैट मीन्स लोअर एंड से ओरिजिन है, अपर एंड पे इंसर्शन है। तो लोअर एंड पे तुमको क्या लगता है कहाँ अटैच होगा ये? Pubic symphysis. What is there just lateral to the pubic symphysis? There is pubic crest. So that means it has got two halves, the medial half and the lateral half. So medial half is attached to the just to the pubic symphysis, and lateral half is attached to the lateral part of the pubic crest. And above it is inserted onto the fifth, sixth and seventh costal cartilages. So it is going above. So it has got two halves, the lateral head from the lateral part of pubic crest, medial head from the anterior pubic ligament which is attached to the pubic symphysis, and fibers will run vertically upwards. They will be extending laterally from xiphoid process, and then they will be cutting or attaching to the fifth, sixth and seventh costal cartilage. ऊपर जाके भी क्या है? There is a horizontal insertion. What is the nerve supply? Again it is T7 to T12. Then the next muscle is the pyramidalis muscle. There is one more thing in rectus abdominis, that is there are tendinous intersections. Can you identify how many intersections are there? 3. There are 3 intersections. Sometimes this question can be asked. So these 3 intersections, one is at the level of xiphoid process, one is at the level of umbilicus, and one is midway between these two. So there are 3 intersections mostly present. अपने cadaver में table पे जाके देखना, sometimes there are more intersections present, then that becomes a variation. These intersections are because of the connective tissue which is present between the muscle fibers, and there is segmental origin of this muscle, so those segments get fused. So sometimes more intersections can be found. So its origin is from the pubic crest plus the anterior pubic ligament from the pubic symphysis. Insertion is to the xiphoid process, 5 to 7 costal cartilages above. It goes like this. Its direction is vertical, and the nerve supply is it is not T7 to T8. All the lower 6 thoracic nerves, they will be supplying this rectus abdominis. Then next muscle which is there is the pyramidalis muscle. So it is an inconsistent muscle. Its origin is from the pubic symphysis and the pubic crest. Can you see this small triangular muscle? It is from the pubic crest and pubic symphysis, and its insertion is on the linea alba. What is linea alba? It is a midline extending from xiphoid process to the pubic symphysis. It is formed by the connective tissue only. There is interconnection between the aponeurosis of all the muscles. So there will be a connective tissue line that is there, and the nerve supply is by the subcostal nerve, that is the T12. So this is very specific. Sometimes the nerve supply of pyramidalis is asked, and we think of that all the nerves, they will be supplying to pyramidalis also, but only T12 or the subcostal nerve, it supplies the pyramidalis muscle. And one more thing which you have to remember is internal oblique and transversus abdominis along with T7 to T12, they are supplied by L1 also. But external oblique is not supplied by L1, and then this pyramidalis is supplied by T12. So this is something which is different. Now just have a look at these 3 muscles. एक तुमको orientation हो जाएगा. So this is the schematic or the line diagram to show the external oblique muscle of the abdomen. Now can you see it is taking origin from लोअर 8 रिब्स. पूरे रिब से आ रहा है, अंदर बाहर सब जगह से आ रही है. कहाँ से आ रही है? रिब में देर आर सरफेसेस, देर इज वन एंगल. तो कहाँ से आ रही है? फ्रॉम दी आउटर सरफेसेस एंड लोअर बॉर्डर ऑफ लोअर 8 रिब्स. हाउ मेनी रिब्स आर देयर? 12. So that means lower 8 means we have left the upper 4. So from 5 to 12 ribs. Then it is also getting origin. There is this is the thoracolumbar fascia. This is the iliac crest. So on to the iliac, where it is attached to which lip of the iliac crest? Outer lip or anterior half of the ventral two-third segment of outer lip of iliac crest. So it is attached to the outer lip of the iliac crest. Then most of its fibers, they will be forming an aponeurosis. And what else is linked to the external oblique muscle? Inguinal ligament. The lower thickened border of the external oblique, it will form the inguinal ligament. और भी कुछ दिख रहा है इसमें? This is what? This is the superficial inguinal ring, or there is a gap in the external oblique aponeurosis which is present, that forms the superficial inguinal ring. The next class is on the inguinal canal. So tomorrow we will be discussing this superficial inguinal ring and the deep inguinal ring. So this is external oblique. Then next muscle is the internal oblique muscle. So internal oblique muscle, it is taking origin from the lower 8 ribs. Then, it is taking origin from the thoracolumbar fascia, from the inguinal ligament, and from the intermediate lip of the iliac crest. So intermediate lip, whole of the ventral segment is involved, and then it is inserted, it is passing forwards, upwards and medially inserted onto the lower 3 or 4 ribs. Then you can see it is also forming an aponeurosis. Mainly the rectus sheath is formed by splitting of internal oblique aponeurosis. When I am saying it is splitting and enclosing the rectus abdominis muscle, that means at the lateral border of the rectus abdominis muscle, it will split into an anterior layer and one layer will go behind. So that means external oblique will automatically come in front and transverse abdominis will automatically come behind. So mainly rectus sheath is formed by splitting of internal oblique at the lateral border of rectus abdominis. And this rectus sheath will be located on one side only or on the both sides? Both sides, because there are 2 rectus abdominis muscle and there are, all the things are 2. There are internal oblique on both sides. So similar things will be everywhere, but in the midline there will be intersections. So then next muscle is the transversus abdominis muscle. Now this muscle, this transversus abdominis muscle, you can see it is also attached to the lateral 1/3 of our inguinal ligament. Then it is taking origin from the ventral segment of the inner lip of the iliac crest. Then it is attached to the thoracolumbar fascia. Then it is attached to the costal cartilages. 6 costal cartilages. All will end up and then they will form the posterior wall of the rectus sheath. One more thing which you have to remember is, जिसको हम कल और इसमें पढ़ेंगे, some of the fibers of internal oblique and transversus abdominis, they will form a conjoint tendon. So only few of the fibers attached to pecten pubis हम देखेंगे कल. So they will form conjoint tendon. So this conjoint tendon also you can see it is visible over here. What is its importance, how it is formed, that we will see tomorrow. Now what can be the actions of these muscles of the anterior abdominal wall? तुमको इनके attachment से क्या लगता है? What can be the actions of the muscles of anterior abdominal wall? पहले भी तुमने पढ़े हैं. क्या करते हैं? They help in respiration or yes, or what will they do with the trunk? मतलब lumbar अगर vertebra अगर इसको ऐसे देखें कि ribs में भी attach है and it is attached, so if they will be contracting, what they will be doing? Huh? Lift what upwards? They will be lifting upwards. दोनों की डायरेक्शन अलग अलग है ऐसे देखा जाए एक्सटर्नल ओब्लिक और इंटरनल ओब्लिक का, but their main action is flexion of the trunk. Okay, so if the muscles of one side will be contracting, they will be doing the lateral flexion of the trunk. If the muscles of both sides will be contracting, they will be doing the flexion of the whole of the trunk. मतलब extensors are located at the back and flexors have to be located in front. So these are the muscles which are responsible. So they are responsible for expulsive acts. What are the expulsive acts meant over here? Forceful expiratory breathing हो गया, और they help in the micturition, defecation also. Of course, when it is forceful, then they are more involved. Then they act as accessory muscles of the respiration. They support the abdominal viscera. They cause the tensing of the linea alba, suspension of the testis also. So that those are the actions of the, mainly they are the flexors of the anterior abdominal wall, causes flexion of the trunk. So then the neurovascular plane, कहाँ से पास हो रहा है न्यूरोवेस्कुलर प्लेन एब्डोमेन में? Internal oblique and transversus abdominis. So that means the course of the spinal nerve, it will remain same as it was in the thorax. So how a spinal nerve is formed? How it is formed? There are two roots. There is ventral root which is motor, there is a dorsal root which is sensory. The two roots will combine and they will form a spinal nerve that will divide into a ventral ramus and a dorsal ramus. So ventral ramus will supply the ventral body wall and dorsal ramus will supply the posterior body wall. And then you can see the spinal nerve is a mixed nerve, or it is a sensory or a motor nerve? It is a mixed nerve. So that means the cutaneous nerves will be coming through it, or the branches will be there, and plus it is supplying the also. So there are muscular branches which will be supplying what? The three muscles, transversus abdominis, internal oblique and the external oblique. And this spinal nerve, you can see it is becoming cutaneous also by giving a lateral branch, and anteriorly also they will be divided. It will itself be dividing into an anterior and lateral branch. So there are these nerves will be cutaneous, and this is the main spinal nerve. At a particular level, it will be supplying the muscles also. So how many cutaneous nerves? इसको एक one thing which everybody has to remember, umbilicus में root value क्या है? What is the root value of the thoracic nerve supplying the umbilicus? That is the T10. So three nerves are above the T10. They are the T7, T8 and T9. That means they will be supplying the epigastrial region. And then three nerves are below the T10. They are T and L1. Why everybody has to remember that umbilicus, the root value of the nerve supplying the umbilicus is T10? Why everybody has to remember this thing? Because all the viscera which have got a nerve supply of thoracic pain will be radiated to the umbilicus. The testis and ovary, both they develop at the level of T10, then they descend down. So that means testicular pain can be radiated to the umbilicus. There are other pains also. So that means you have to remember the root value. The T10 is umbilicus. Three segments are above the umbilicus and three segments are below the umbilicus. So they are providing the cutaneous and the motor innervation present between the transversus abdominis and the internal oblique muscle. The L1. Now coming to the arteries. One more thing which you have to remember in abdomen is that umbilicus, the level of the umbilicus, it acts as a watershed line. Umbilicus is at the junction, या फिर we call it the line at the level of umbilicus as the watershed line, because arteries or the region above the umbilicus is supplied by different arteries which are coming from above, and the region below the umbilicus are supplied by arteries which are coming from below. So above the umbilicus, the artery is, can you see which artery is there? You are familiar with that artery. It is the internal thoracic artery dividing into musculophrenic and the superior epigastric. So in the midline, this artery, it passes inside the rectus sheath, and the main artery is the superior epigastric artery, a branch of the internal thoracic artery. Then there are please, no talking. There are posterior intercostal arteries also, which supplement this superior epigastric artery in supplying the region located above the umbilicus. And below the umbilicus, the main artery is the inferior epigastric artery. It is a branch of external iliac arteries. Both these arteries, they pass inside the rectus sheath and anastomose with each other. And the region below the umbilicus is also supplemented by the superficial and deep branches of the femoral artery. So what are the three superficial branches of the femoral artery? Superficial, epigastric, external pudendal, and the circumflex iliac. So this region along with the deep circumflex iliac branch, so these arteries, they will be supplying the lower abdominal region below the umbilicus. So that means the source of the arteries is entirely different above umbilicus, and it is entirely different below umbilicus. Above umbilicus, it is the subclavian artery, then internal thoracic, and then superior epigastric. Below it is external iliac, and then the femoral artery, which are supplying the region below them. The same thing happens with the venous drainage and with the lymphatic drainage. So that means the level of the umbilicus is known as a watershed line. So again, internal thoracic artery, there are posterior intercostal arteries, deep circumflex iliac, the three branches from the femoral artery. So they will be supplying Similarly, the veins are also paired with the arteries. Above the umbilicus, they will be draining into the azygous system of veins, and below the umbilicus, they will be draining into the femoral system of veins. If you remember, there are three tributaries of the great saphenous vein which were opening just before the saphenous opening. They open into the superficial epigastric vein. So those veins, the external pudendal, so they will be draining the region below the umbilicus, and above the umbilicus, it goes into the azygous system of veins. So what are the three veins in the azygous system of veins? So they will be going in the system. Then add the umbilicus. Again, the lymphatic drainage is also different. Above the umbilicus, the lymphatic vessels, ultimately they will be draining into the axillary group of lymph nodes, and ultimately these will be draining into the superficial inguinal group of lymph nodes. So there can be sternal also, there can be para-aortic also, but ultimately they will be draining into the axillary group of the lymph nodes. So axillary, sternal, then superficial. Now the last part of this class, that is the rectus sheath. सारी हमने मसल्स देख ली. We have seen all the muscles and they were all combinedly forming the rectus sheath. What is the purpose of rectus sheath? What is the purpose of rectus sheath? What can be the purpose of the rectus sheath? Which type of muscles is rectus abdominis? It is which type of muscle? Vertical. It is a vertical muscle. It is covered by a sheath and it is present near paramedially, but not in the midline, just it is present just lateral to the midline. So there is a sheath which is covering the rectus abdominis muscle. Its function is to prevent bowstringing of the muscle. ठीक है, वो जैसा हमने इसमें पढ़ा था, there were retinacula. Which retinacula we read in the upper limb? There was flexor retinaculum, there was extensor. So they were keeping the tendons in place. So similarly, this rectus sheath also prevents the bowstringing of the rectus abdominis muscle. So how it is formed? दोनों पिक्चर्स में क्या डिफरेंस लग रहा है? अब तुम लोग बात नहीं करोगे, बहुत काम कर लिया, अब तुम लोग करोगे. पहले वाले पिक्चर और नीचे वाले डिफरेंस पिक्चर में क्या डिफरेंस है? इतना बता देती हूँ कि दिस इज फॉर्म्ड बाय rectus sheath is formed by splitting of internal oblique muscle, but then there is some difference. हाँ, तुमको पूछ रहे हो. हाँ, ऊपर वाले और नीचे वाले पिक्चर में क्या डिफरेंस है बताओ? इसमें क्या हो रहा है? rectus sheath कैसे बन रहा है? एंटीरियर वॉल में कौन कौन सी मसल्स हैं? यहाँ पे एंटीरियर वॉल और पोस्टीरियर वॉल में कौन कौन सी मसल्स हैं? देखने से पता लग रहा है. हाँ हाँ, सेकंड वाले में गैप है दोनों रेक्टाई मसल्स के बीच में, फर्स्ट वाले में कोई भी गैप नहीं है. So that means linea alba is thicker in this part and linea alba is thinner in this part. ये बहुत अच्छा, मतलब एक सही ऑब्जर्वेशन किया है. और अब we are talking the formation of rectus sheath. So sheath is a wall. वॉल के अंदर की बात तुमने बता दिया सेंटर में. और कुछ? Sit down. You were telling? You want to tell? Contraction of? नहीं, just tell the formation of the rectus sheath. दोनों इंटीरियर और पोस्टीरियर वॉल में कौन कौन से मसल्स इन्वॉल्व है वो बताना है. यहाँ पे एंटीरियर वॉल कौन कौन बना रहा है, यहाँ एंटीरियर वॉल कौन कौन बना रहा है? कोई डिफरेंस है? हाँ, यस. सो वन, हाँ, और दूसरे वाले में all the three muscles they are passing anterior, they are forming the anterior wall. Sit down. तो एक पैथोलॉजिकल है और एक फिजियोलॉजिकल है, ऐसा है क्या? नहीं, दोनों ही, they all are present. There is one place which is known as the arcuate line. This arcuate line is present midway between the pubic symphysis and umbilicus. So at the level of the arcuate line, the rectus, below the arcuate line, the rectus sheath, पहले तो देख लो rectus sheath बनता कैसे है. It is formed by splitting of internal oblique muscle aponeurosis into two layers. So anterior layer of the internal oblique, it will pass anterior to the rectus abdominis, and posterior layer of the internal oblique aponeurosis will pass posterior to the rectus abdominis. So that means anterior wall of the rectus sheath here is formed by external oblique and the anterior layer of internal oblique aponeurosis. Posterior wall here is formed by posterior layer of the internal oblique aponeurosis and the transversus abdominis muscle. Along to support the, no talking. Behind the transversus abdominis or inside transversus abdominis, there is a fascia, that is fascia transversalis. So that will come in the posterior wall. below the level of the arcuate line. This arcuate line is present midway between the umbilicus and symphysis pubis. The anterior wall of the rectus sheath is quite thick because all the muscles, they are forming the anterior wall, and it is unsupported posteriorly, because you can see the fascia transversalis only will be going. इसमें ये भी दिखाया है, but only the fascia transversalis is there below the arcuate line. So there are three different levels where we can define. There are three different ways of formation of rectus sheath. That is above the costal margin, between the costal margin and arcuate line, and below the arcuate line. Okay. So here you can see this is the picture above the coastal margin. मुझे एक बात बताओ, कोस्टल मार्जिन में रेक्टस एब्डोमिनिस कहाँ तक जा रही है? Where it is attached? It is attached to what? हाँ, 5th, 6th and 7th coastal cartilages and the xiphoid process. So there the rectus abdominis is not supported posteriorly by any muscle, or rectus sheath is deficient, or rectus abdominis will lie directly on the ribs or the costal cartilages. Only external oblique will be forming the anterior boundary of the rectus sheath, where above the costal margin. Then between the costal margin and the arcuate line, you can see the rectus sheath is formed by splitting of internal oblique. One layer is going anteriorly, so external oblique and internal oblique. One layer is going posteriorly, so this is internal oblique and transversus abdominis. ये कहाँ तक चल रहा है ऐसा? Till the arcuate line. And below the arcuate line, you can see all the three muscles, they are going anteriorly, and only fascia transversalis will lie posteriorly. को कैसे दिखेगा डिसेक्शन में? रेक्टस एब्डोमिनिस कैसा है? इट इज वर्टिकल. व्हेन यू विल बी डिसेक्टिंग इन द मिड लाइन, यू विल सी दैट rectus abdominis is contained inside a pouch. So you have to open that pouch. So when you will open that and remove rectus abdominis, that means the anterior layer of the rectus sheath will be removed and the rectus abdominis will be removed. What will be left? The posterior wall of the rectus sheath will be left. There you will be able to identify a line, that is the arcuate line. I'll show you that. So here you can see this is the rectus abdominis placed intact in the cadaver. So when we will remove the rectus abdominis, what you will be seeing? The posterior wall of the rectus sheath. So somewhere you will find that whitish fibers are less thickened or they are almost not visible, क्योंकि जब तीनों ही मसल पोस्टीरियर एब्डोमिनल वॉल की यहाँ तक, तो यहाँ पे मुझे बताओ पोस्टीरियर वॉल कौन कौन बना रहा था? टिल द आर्क्यूएट लाइन. दिस इज द आर्क्यूएट लाइन मिडवे बिटवीन द अम्बिलिकस एंड प्यूबिक सिम्फाइसिस. हाँ, इंटरनल ओब्लिक एंड दी ट्रांसवर्सस एब्डोमिनिस. तो यहाँ तक तो तुम्हें लगेगा कि बहुत थिक है, एकदम से दिखेगा कि देयर इज अ ट्रांजिशन and the posterior wall is very thin, because here it will be formed only by the fascia transversalis. So that is below the arcuate line. So this is, again you can see there are contents of the rectus sheath also. What is present inside the rectus sheath? So what is present? The superior epigastric artery and vein and the inferior epigastric artery and vein, and their anastomosis also occurs inside the rectus sheath. So they will be there. The lymph nodes also, they will be present. Again the same thing is there, but only thing is this slide is showing there is the linea alba is well developed in the upper part, जो इसने बहुत अच्छा point out किया था. Like उसने, क्या नाम है तुम्हारा? हाँ खड़े हो जाओ, क्या नाम है? हाँ कुलदीप, इस इसने, ठीक बोल रही हूँ मैं, गलत बोला मैंने नाम? हाँ, तो कुलदीप ने बिल्कुल मतलब ठीक पॉइंट आउट किया था कि लीनिया एल्बा या वो जो थिकेंड पार्ट था, दैट वाज, इट वाज वेल डेवलप्ड इन द अपर पार्ट एंड इट वाज पुअरली डेवलप्ड इन द लोअर पार्ट. हम देख रहे थे ना, दोनों रेक्टाई बिल्कुल अलग अलग थे और मिड लाइन में कोई भी इंटरसेक्शन नहीं दिख रहा था. सिट डाउन. But this is that. So right and left recti are well separated. So they are close together over here. So it is like that. Now coming to the hernias. What is hernia? Abdominal extension क्या होता है? The exact definition of hernia is protrusion of a viscous. बस ये लास्ट स्लाइड है, बाकी हम इंग्वाइनल कैनाल, इंग्वाइनल हर्निया वो हम कल पढ़ेंगे. ये एब्डोमिनल इंसिजन भी बाकी है, वो कल कर लेंगे. सिर्फ एक ये वाला स्लाइड देख लो, व्हाट इज अ हर्निया, क्योंकि तुम एब्डोमेन में सबसे ज्यादा जो मिलेगा दैट इज हर्निया. व्हेन यू विल बी रीडिंग एब्डोमेन, हर कोई विसरा जो है, मतलब मोस्टली द इंटेस्टीन दैट हर्निएट्स आउट. सो हर्निया इज प्रोट्रूजन ऑफ द विस्कस थ्रू द वॉल कंटेनिंग इट. इट्स नॉट लाइक कि वो कहीं भी चला गया. सो जिस वॉल में वो है वहीं से बाहर आ गया, सो दैट इज द along with the wall containing it, so that becomes the hernia. In the anterior abdominal wall there are ventral hernia. So all the hernia which can occur in the anterior abdominal wall, they can be named as ventral hernia. But if the hernia is occurring at the umbilicus, that is umbilical hernia. If it is occurring at the junction of arcuate line and this portion is known as linea semilunaris, then that is known as spigelian hernia. कल इसे और डिटेल में पढ़ लेंगे. थैंक यू.